There's also some COVID confusion right now on the new booster shot.
We're listening to a CBS News Chicago viewer tonight who told us he was shocked to learn the shot he was going to get cost more than $100 because of a change in federal funding.
Lauren Victory breaks down what you need to know before you get vaccinated.
I think that a lot of people will give up quickly.
Ed Plimmel shows us a mark from the recently released updated COVID-19 booster. He says the shot was a hassle to get.
I thought it would be just as easy as every other year.
For Plimmel, that meant dropping by his local pharmacy, where immunizations were free in the past. After all, it's preventative care. But this time,
He said that he could give us the flu vaccine, but that the COVID vaccine wasn't covered, which I just assumed was a mistake. And so he rechecked and he said, nope, the flu vaccine's covered, the COVID vaccine isn't.
the out-of-pocket cost, more than $100. You might run into the same issue if you're not prepared. The Centers for Disease Control and Prevention explains that the Federal Drug Administration ended a program that provides free COVID-19 vaccines in August 2024. But
the COVID-19 vaccine is no cost with most insurances.
CVS pharmacist Sume Shakalakul explains the one extra step you'll now need to take to get a COVID booster for free.
You just have to make sure that you go to an in-network pharmacy to get that vaccination.
In other words, check your health plan. If your insurance doesn't cover a COVID-19 vaccine at CVS, pharmacists will still provide one to you, but the charge is about $200. The Walgreens out-of-network price for the new COVID booster was a little harder for CBS News Chicago to find, until we learned you need to search by the vaccine's official name: Comirnaty for Pfizer, Spikevax for Moderna, and newer to the market, Novavax.
How much time would you say you spent on the phone trying to figure out who would cover your COVID vaccine?
An hour and a half, couple hours trying to figure it out.
A frustrated Plimmel says he got conflicting info from his Medicaid provider, Blue Cross Community.
I still have no idea what's going on.
Meantime,
I'm surprised it hasn't healed.
Plimmel found a spot to get a shot where insurance coverage didn't matter. But even that was a challenge because not all medical providers are offering the booster just yet. For example, it likely won't be until October that the Chicago Department of Public Health is able to offer COVID vaccines for adults at its free immunization clinics.
Do you anticipate in the coming weeks there will be lots of questions about this?
Hopefully, the information will be out there.
We hope this news story helps. Before we left CBS, we thought we'd ask a couple rapid-fire questions, too. Who should get the new COVID-19 shot?
Right now, there is a universal recommendation that all patients 6 months and up get vaccinated.
Why get boosted again?
The immunity to the virus does wane over time.
And finally, can you get the COVID and flu vaccines at the same time?
We've had multiple patients get both at the same time, getting them in the same arm.
Side effects are usually mild. Hopefully your search for an insurance-covered COVID shot is, too. Lauren Victory, CBS News, Chicago.
We asked Blue Cross Blue Shield Illinois multiple times to clarify if COVID boosters are supposed to be free at Walgreens and CVS. The final answer: coverage varies based on plans.